Well, Spokane has a drug problem. It's a problem that doesn't just impact the person who's using. It affects the community, families, and for some women who get pregnant while using, it means their babies could be born with drugs in their systems. 4 News Now's Robin Nance takes us to a place doing innovative work with babies withdrawing from drugs and their mothers. That work could impact not just Spokane and the state, but the entire country and beyond.
Hi, handsome.
This is 4-month-old Zachariah. From all appearances, a perfect baby boy. What you can't see is the battle he's facing inside. Zachariah was born with drugs in his system. His mom, Mary, was a drug user for 7 years.
Fentanyl and meth.
She was using until she found out she was a couple of months pregnant. Mary checked herself into a drug rehab in Seattle and got on methadone to help her get clean. But methadone is also a narcotic, and that drug was being passed on to Zachariah.
So he had to stay in the NICU for like a month and a half.
When Zachariah was released from Sacred Heart's neonatal intensive care, he came here to Maddie's place, which also took in Mary to keep mom and baby connected. Bonding within the first 90 days is one of the first struggles these drug-affected babies often face. What's uncertain is what happens later in life. These kids often face learning, behavioral, and mental health challenges. Intervention now could change the course of their entire life.
Our mission is to provide nurturing, medical care, non-medical care, and support to drug-dependent infants and their mothers.
Sean Cross is the president and CEO of Maddie's Place, the only pediatric transitional care facility on the West Coast, and only one of 4 like it in the entire country. The focus here is non-pharmaceutical. These babies are cared for, as you can see, in a quiet, low-stimulus setting. Caregivers, like Taylor, provide a number of different comforting methods, including frequent carrying, holding, and careful feeding. It's licensed to treat up to 16 infants and 13 parents at any one time. Since opening in October of 2022, it's cared for 64 babies. Cross says what's happening here for these drug-affected babies and their mothers is cutting edge.
And what we're learning is that what we're doing for the babies is more significant for the moms even than maybe we initially appreciated.
Those beliefs about the impacts of Maddie's Place have been just speculations, but we're about to have some solid facts in the form of a Washington State University research project.
What we find here is most likely going to be quite innovative.
Professor and Executive Vice Chancellor at WSU Health Sciences, Celestina Barbosa-Leiker, is leading a team of researchers with a deep bench of expertise. The team will study the health outcomes at Maddie's Place under a state pilot program.
This study has the potential to impact how services are being given to moms with and babies with neonatal abstinence syndrome, not just here in Spokane County, across the state of Washington and nationwide as well.
While the research will tell healthcare providers a lot about drug-exposed babies in Spokane County, including just how many there are, it'll track the methods at work at Maddie's Place and could ultimately affect how that work is paid for. Right now, private insurance does not cover patients here. Cross wants the study to be a launch pad for Medicaid to pay for programs like Maddie's Place, which could fund more facilities and work like this around the country. In the meantime, here in Spokane, this place, Maddie's Place, is making all the difference to this baby and his mother, who says if she wasn't here, she and Zachariah would be living on the streets.
I love this place so much. I'm so thankful they have a place like this.
In Spokane, I'm Robin Nance, 4 News Now.